Good morning. I'm Ann Bishop, Executive Director of Texas Public Employees Association. And Texas Public Employees Association was created by state employees and the leaders of the state of Texas for the purpose of improving and providing quality workforce for the citizens of the state of Texas, because if you don't have a quality workforce, then the services suffer and taxpayers suffer. So I'm here to talk about the workforce issues of the Department of State Health Services. As you know, in the last couple of years, especially with this agency, how agencies have stepped up and how agencies are really the unsung heroes when everything goes well. But when emergencies happen, they're also there. And COVID is a perfect example of an emergency happening and the agency being prepared to address that issue. And they would not have been prepared to address those issues if they didn't have a quality workforce. And we appreciate Dr. Hellerstaff's service, and we want to give him a recognition he deserves by leading the state admirably during his career. And I personally appreciate it, as well as on behalf of the citizens of the state of Texas, want to thank him for his service and congratulate him in his retirement. But with that said, if we don't invest in our workforce now, we won't have a workforce. And while turnover may not be as high in this agency as the statewide average, remember that the statewide average includes agencies that have 70% turnover. So when you compare, it's really, if you were doing statistics, you'd throw out the low and the high, and you would actually get a different type of average. So 17% turnover is still a very high turnover in a lot of positions. These are highly technical, highly educated, skilled staff. And it is hard to not only attract people to these positions, but it is also hard to retain them. If they're not getting salary increases by which they want to have a career with the state, then you start losing these people. And let me give you an example. Sometimes agencies have to pay more to attract new employees. And when you do that, you have salary compression with existing employees who have years of service and tenure. And you're going, wait a second, this is a new person coming in. Granted, they have the same education as I do, but they don't have the same experience I do. They don't have the same tenure as I do, but yet they're making a very similar salary. So you got to give people incentives to be able to stay in the workforce. And what happens, too, when they're eligible to retire, you actually see two demarcation points in the workforce. One is people hitting 10 years of service. And 10 years of service is important for some groups to hit insurance so that they will be eligible for some form of insurance. That doesn't mean it's paid for. It just means they're eligible to stay in the group insurance plan when they retire. The other is when they're eligible to retire. And I submit that these people are also very valuable to the state for succession planning and other opportunities. If they are leaving, then a number of agencies are forced to fill those vacancies and have those positions open for a long period of time. And that's another metric to look at. It's just not only turnover rate, but how long it takes to fill a position. And a lot of times the state law requires retirees to stay out of the workforce for 90 days, and then they are eligible to come back. You'll see agencies now hiring return-to-work retirees, which I don't blame the return-to-work retirees. They get now a better overall compensation. I don't blame the agencies because they're fulfilling their duties. They're able to get experienced people. But it does have an impact. You're filling a position that then may not be available for somebody else to then ultimately be a benefit in the long term for the state. So I request that you not only look at the targeted pay raise, which, by the way, the LBB did a wonderful report. There's a lot of wonderful reports out there from the state auditors and the LBBs, but the 2019 report on the overview on effectiveness of targeted pay raises actually indicates that there is only and I quote, in most of these cases, pay increases were associated with a short-term decrease in turnover rate. And as somebody who is a public policy nerd and likes public policy, we would like to recommend that you look at a longer-term solution to salaries and pays and include all state employees. And I'm happy to answer any questions, happy to provide you copies of reports if you want to, or be a resource.
Are there any questions?
Thank you.
Thank you.
Thank you for your time and thank you for your service.